Come in.
Hey, Mr. Earl, my name is Lauren Stewart. I'm a nursing student at the University of South Alabama. I'm going to be doing your head and neck assessment today. Is that okay?
Yes, ma'am.
Alright, I'm going to perform some hand hygiene. What I'm going to do first is I'm going to assess your face symmetry, or your face symmetry. So I see your eyes are symmetrical, your ears, your nose. So this is really good. And next I'm going to palpate your scalp. So it is dark in color. It is stiff and from product. And I see no signs of infestation or anything and no abnormalities in your skull structure. So was there any tenderness while I was palpating?
No, ma'am.
Alright, so next I'm going to check cranial nerve 5. So I'm going to have you clench your jaw for me. And I'm going to palpate. Alright. So I see that it is equal and symmetrical, and that's your motor function. So now I'm going to do sensory. So I'm going to have you close your eyes, and I'm going to touch your face 3 times on each side, and you tell me when you feel it. Just say no. So. Alright, great. So we see that the sensory and the motor function of cranial nerve 5 is intact. So now I'm going to go on to cranial nerve 7. So I'm going to have you make a bunch of funny faces to do the motor sensory. So I need you to smile, frown, puff your cheeks out, raise your eyebrows, and squint your eyes closed. Alright, very good. So it means that the motor function of cranial nerve 7 is intact. So now for the sensory, I'm going to have you close your eyes and I'm going to have you smell something and you tell me what it is.
Perfume.
Perfume. And then I have you close your other nostril and identify.
Perfume.
Alright, great. So we see that the sensory function of cranial nerve 7 is intact. So now I'm going to look at your eyes. Will you open them for me? So now we see that the bulbar conjunctiva is clear. We see that the palpebral conjunctiva, which lines the upper and the lower lids, is pink. Your eyelids are moist and the same color as the rest of your skin. Your brows, your eyelashes are dark in color. There is no ptosis present, which is the drooping of the eyelids. And your sclera is white with no redness or jaundice. So now I'm going to assess and describe your pupils. So I'm going to assess both pupils. So you open your eyes for me. They are both equal bilaterally and they seem to be the both sides. So measuring. There we go. And they seem like they are no more than 1 millimeter. They are both round in shape, and I'm going to flash this light at you and we're going to see how they react. So, alright, open your eyes for me. Alright, they both react to the light. It has constriction when the pupil dilates with the light on it, and dilation when it gets bigger from the light going away. So these are very good. I'm going to have you converge your eyes inward, so having a cross-eyed, eyes open, cross-eyed. Okay, so we see that they are able to converge inward, which is great. So we see that they reacted to the light. That's good. So now I am going to do the 6 cardinal positions of gaze. So you're going to follow this in 6 different ways. So we're going to start right here. Go this way, this way, this way, this way, this way, and this way. Great. So we see that the oculomotor, the tracheal, and the abducens are intact. So we're going to see how your corneal light reflex is. So I'm going to shine a light equally in both. Great. So they seem that they are both equal. So now I'm going to do the visual acuity test. So with this, I would be doing the Sheehan eye chart, where you would cover one eye 20 feet away and tell me the letters you see on the board. And do it the other way and tell me the letters you see on the board, but we do not have that, so we will not be doing that today. And we would also do the handheld vision screener. It kind of looks like a camera and a test. It'd be 14 inches away from your eyes, and it would test your vision bilaterally and like check the pressure of your eyes, but we're not doing that today either. So now I'm going to assess your ears. So we see the helix is present, the anti-helix is present, the external auditory meatus is present, the tragus, the antitragus, and the lobular is present. Do it on this side. Helix is present, anti-helix is present, the auditory meatus is present, the tragus is present, antitragus is present, and the lobular is present. So now I'm going to perform the sensory or the hearing acuity test. So now I'm going to have you hold one ear at a time. Can you hear that?
Yes.
Other one?
Yes.
Great. So now I'm going to check your nose. I'm going to palpate your nose and you tell me if you feel any kind of sensitivity or anything like that. Tenderness.
Uh-huh.
Alright, so I'm going to have you lean your head back and I'm going to check inside your nose. So nasal mucosa present, your septum has no deformities, and your terminates are present inside your nose canal, okay? So now I'm going to check your cranial nerve 1, which is the olfactory nerve. So I'm going to check its check your symmetry bilaterally, so we see that it is symmetrical. So now I'm going to have you hold one nose and blow with the other. Great. Great. So now I'm going to have you identify another aroma. Hold one nose and smell. What were those? Alright. So now I'm going to check your mouth and your throat. So we see, when looking, that your mouth is pink and moist. Open it up for me. We see that the buccal mucosa is pink and moist. We see that your gums are pink and healthy. Smile for me. Pink and healthy. Your teeth are white and clean. Open up again. Your tongue is pink. I'm also seeing that your hard palate is interior and white, and your soft palate is posterior and pink. And then we also see your uvula is pink, and I see no tonsils present. So I'm gonna say go. And I also see, raise your tongue for me too. I see no lesions on the bottom of your tongue. So now what I'm going to do is identify your lymph nodes. So I'm going to start with your preauricular, your postauricular, your occipital, your tonsillar, your submandibular, your submental, your superficial cervical, your posterior cervical, your deep cervical chain, and then your supraclavicular. Alright. So now I'm going to check your cranial nerve 11. So it's your spinal accessory nerve, and I'm going to have you turn your head side to side and do resistance against my hand. Very good. Very good. So now I'm going to prod or do resistance on your shoulders and you raise them. Very good. All right, and then my head and neck assessment.